Well, by now, of course, you've all heard the news that the great scientist Stephen Hawking has passed away. He's been called the greatest scientist since Albert Einstein. He also struggled throughout most of his life with motor neurone disease. It didn't stop him doing his extraordinary work, but what impact does that illness have on people? Do we know enough about it? Here to talk about it is our resident doctor, Brad McKay. Nice to have you with us.
Same here.
Motor neurone disease, what is it?
Yeah, so motor neurone disease is the same thing as ALS, which
It has many names, doesn't it?
It's got a few different names. So yeah, ALS stands for amyotrophic lateral sclerosis.
Well, motor neurone disease is easier to say.
Easier in Australia to say,
Yeah.
and in the UK. So America sort of has the ALS as their term. So it really doesn't normally affect the brain itself. So your cognitive ability, about 10% of people have a problem with that, but the vast majority of people can think quite clearly and quite competently, obviously with Stephen Hawking. What it does affect is the motor nerves, and you've got your upper motor neuron nerves and your lower motor neuron nerves.
Okay, so when we're talking about that, how would that manifest itself? Is this where we're seeing the slurred speech, the problems with breathing, the problems with movement and walking?
Yeah, so when doctors talk about motor nerves, we talk about the nerves that are activating muscles. So whether that's your ability to stand up out of a chair or walk or talk or breathe or swallow, all of these things are activated by your motor nerves. If you've got a problem with your lower motor nerves, then it will cause problems with wasting of your muscles. They'll just start to waste away because they're not getting a signal from your nerves. If an upper motor neuron is affected, which is in your spinal cord, then that doesn't sort of pass on that signal properly. The lower motor neuron doesn't know what to do, and so it activates the muscle, and so you'll get spasticity. So it can be a mixed picture from spasticity to weakness.
And it's progressive as well. So if you get this, it is going to get worse.
Yeah, so it's a horrible condition. So we find that the average age of diagnosis is about 45 years of age. With Stephen Hawking,
21.
21, very young to be diagnosed with this, and he was told that within 2 years he'd be dead. So we find that about half of people will survive over 3 years. We find that less than 10% of people will last more than 10 years. So he's really outlived most other people.
Why is that? Can you identify why some are going to live longer than others?
Yeah, it really depends on the pattern of what nerves are affected.
So breathing, of course, a big problem.
Yeah, so if your diaphragm isn't innervated by your nervous system, then you won't be able to breathe properly, and so you'll quickly die. If you're unable to swallow properly, then you'll be inhaling your saliva and then causing pneumonia from that. And so a lot of people will die from respiratory tract infections. So with him, he sort of started using a walking stick in his mid-20s, and he got married in his mid-20s as well. He later on in his 20s, he ended up being in a wheelchair, which he hated to be in, and then raced all of his way around Oxford University in Cambridge. And so over time, he just started to lose more and more ability to function. So,
but didn't lose that ability to work and the energy he could bring to that as well. So is that what people are able to do as well? You can still pursue what you love. You can still be very active. You can work. You can be engaged. You can have a family. Are all of these things possible?
Yeah, I think this is what made Stephen Hawking so inspirational, because he really concentrated on the positives. He really focused on what he could do rather than what he couldn't do. And he told other people, like, don't regret what function you don't have, but really concentrate on what you can do and make that optimal. So for a period of time, he could use one finger. So he could write and communicate and pick up letters on a computer screen from that one finger. Over time, that failed, and then he ended up being able to use muscles in his cheeks, and then that was linked to a switch in the glasses that was sitting on the side of his head, and so he could choose letters and then have predictive words as well, predictive text, that he could then communicate with people. So it's just phenomenal how he was able to continue communicating over the period of time.
That's not typical, though, is it fair to say?
So I think from him being able to still swallow, from him still being able to breathe, that's really been able to maintain his function over this period of time.
Now, when we look at who is more likely to get this, there is part of this that is genetic, it's inheritance, but that doesn't explain all of it, does it?
Yeah, so 90% of cases are sporadic when it just happens. and you've got no family history, about 10% of cases are from a familial motor neuron disease, where somebody in your family has had it in the past. So if say your father has it, and then you would have a 50% chance of getting those genes. But then if we're doing a genetic test and seeing if you've got those genes or not, if you've got the genes, it really doesn't mean that you're going to develop it. So you've got a higher chance of getting it compared to the rest of the population.
So people can have this test to identify whether or not they're potentially going to get it.
It's not Medicare funded, but you can get the genetic test done. And so then you're able to determine what your risk is. But some people choose not to have the test at all because it doesn't really mean that they'll get the disease or not. And often people don't want to know.
Just a couple of things. We've got about a minute left, but how widespread is it? And what about ongoing treatment, medication?
Yeah, it's still a very rare disease. I think a lot of people got very sick of not having any cures. We have very few medications that can only give people another sort of few months progress before dying. So this is a really difficult situation. Everyone's heard of the ALS Ice Bucket Challenge that happened in 2014, where everyone's pouring ice over their heads. So this was really to fundraise and to create awareness about this rare neurological condition, so we can research further into it. There are so many parts of the nervous system that all need to work in synchrony and work together, and there's so many different parts of that pathway that can break down. So we're still figuring out what's causing it in different people, and the next thing is trying to find a cure for it.
Well, a chance to remember a remarkable life as well. Brad, thank you again for coming in.
Thank you.